public meet and greet with us that has immediately been followed by a second one. Like, oh, we now have another case. All the reassurance me every day. It's registering. Let me.
Yeah, I mean.
I'll use my earbuds, and you don't know.
I don't know if that's.
Mic check. Mic check, mic check, mic check, mic check. Can you hear me? Testing. Mic check, mic check. Mic check, mic check, mic check. Mic check, mic check. I will continue to talk so.
So our engineers have. Yeah.
We have to switch to the hard. Just can't get my phone even right now. Well, it's just this.
Oh wait, don't you need to use mine?
No, because I put my receiver on there.
Oh, you did.
Could you come up here and test it again?
Yeah. Mic check, mic check, mic check, mic. Okay.
Let me get one more white balance while you're up here. Does the zebra not work on this thing?
I don't have it on.
How do you turn it?
I don't know.
I mean,
I had settings on my old one, but they replaced it, and I haven't been able to figure out how to.
all right, I got it. You don't have to stay up there anymore.
Oh, okay.
So I said, hey, it's not this adjustment. You can adjust here. To me, it actually it's a model. It's not. You can do what you want. But so I told our guy that's doing it. So we have it all at once.
Do we need to clean off this card, or is there enough space on it? Or?
There's plenty of space on it.
It doesn't have the little time. Maybe yours doesn't do that, where it tells you how much.
I've seen it. Yeah, I said. Oh yeah, No, it's not good.
Weren't we just here?
At least this one has this little shoulder.
Yeah.
It's got all kinds of
Immediate is
Right. We're calling it, we're just calling it this here.
I tried. Yes. Because I'm not a boss. Well, we always, one of us has to be in there. Do stuff to the website. Well, we could go ahead and post stories earlier and all that stuff, but it screws up the date. You can't do it ahead of time.
Nobody important.
You can do a lot of things. I mean, we can do the email.
Yeah.
If it was done right now, we can go ahead and schedule it. We can schedule the stories to be posted. You've got to make the homepage work right. You've got to have this stuff. Well, yeah, it's easier. It's the only way to change the actual homepage. Usually I'm the one to do that because, but recently especially,
Oh, he's gonna do his own show.
The thing is, there have been times, but it's not always, it's not always. I mean, it can be, I can be a lot of times. We're done by 12 to 5. Yeah, it's not like.
I don't have too much greater.
Also, sometimes.
Into this, quick setup. Retired.
That small camera. These cameras.
Amateur. What the journalists.
Yeah, from here. I like videos too. I honestly don't think it's that. I don't really think it's a whole lot better. I got pretty good on videos. It's just smooth, yeah, it's just not hard to do.
This is a different podium or the same podium?
I
I don't know.
don't lean on.
Don't lean on it. Okay. Don't lean on the podium. It's the rule. I thanks everybody for being here on such short notice. We appreciate that. We just wanted to be really transparent and update you regarding, you may have seen that Knox County on the state website now has 2 cases of COVID-19, and we wanted to clarify that. We said we'd come to you and talk to you if we saw that we had community transmission. That is not this. I want to repeat, this is not a case of community transmission. The way the state and the federal government count diseases is based on address of record. The address of record for the person who tested positive is in Knox County. This person was tested in a different state and lives in a different country and has not been in Knox County during any period of their infectivity or during any period of their illness or before. So this was, again, a person who has their address of record in Knox County, lives in another country, got tested in a different state, and has not been in Knox County. So this does not pose any threat to anybody in Knox County. We wanted to clarify that because it is confusing. We're actually working to see if they will change that. We don't know if they will. So we're asking that the state look at that and work with probably the CDC to change that. But again, this person hasn't been here. They live in a different country, tested in a different state, and hasn't been here at all. So that's it. Any questions?
Yeah, there's a question that Greenville is the only place that has a mobile testing site. Are we going to have those pretty soon? Do you know?
Well, we're working with all of our partners to see what's possible for us to be able to do here in Knox County. I'm not familiar with what they're doing in Greenville. That's interesting, and we'll make note of that and reach out to them and see how they've made that happen. As you can imagine, there are a lot of logistics and things that have to go into being able to do that. One of the challenges that we have is that the supplies to obtain the swabs, we've talked about, there's obtaining the swabs and transferring the swabs to the lab, and then the lab doing the test. So the supplies for obtaining the specimen and sending the specimen to the lab are limited and in limited availability. So that's one of our challenges right now. And it's not just for Knox County, that's a challenge across the country, across the state.
Do you know when that patient was last in Knox County that tested out of state?
Yeah, I don't know. What I know is what's important for public health purposes is that that person has not been in Knox County during any time of their illness. They've been either out of the country or in another state.
Do they have family here that may have to be in isolation or something?
They haven't been here, so.
If this is happening across the country, is this something that could be throwing off numbers in other places as well?
I'm sorry, if what is happening?
That people are being counted in local totals but are not actually living there, have not been there. I mean, obviously you can speak to Knox County,
Right.
but what do you think?
And this is a guess, which is not good to do, but I don't think it's a very common occurrence. It happens rarely when we have even larger outbreaks. Occasionally somebody will be somewhere else and they get counted here because that's their address of record. It's not all that common, but it is just kind of how they count things. Again, we're working to get that changed so that this person will appear in the appropriate place, but we're not sure if we're able to do that.
Do you know which state they were tested in?
They were tested in a state that has ongoing community transmission.
You said it earlier today, and this is not a quote, but in essence you said that you don't feel the total number of tests performed is a meaningful stat to release to the public. I'm not a doctor, I'm not an epidemiologist, I'm not an expert. But I'm just trying to understand that because I'm wondering how like say if you have one confirmed case and you've tested 5 people, that seems a lot less meaningful than saying we've tested 100 people, we have 1 confirmed case. It's kind of like, how can you find something if you're not looking for it?
Well, the truth is we're looking for it, and not just us. Private providers are also testing. The capacity for private providers is only going up day by day, and so they're increasing access to testing in their facilities as they are capable of doing that. So right now, people can get tested in their private doctor's office or by the Department of Health, by us. But always call before you go and they can advise you whether you need to come to the office or some other option. And always call us before you go. That's really important to remember. But private providers make a decision about testing based on the criteria that they have with their internal controls. So private doctors' offices, we don't dictate who they test. We don't tell them who they can or cannot test. We give them guidelines and recommend that they test people who have a fever and a cough. But they don't have to follow those guidelines. So we know that there are lots of people being tested out there that aren't at risk for COVID-19. We rely on our private providers to help us find cases that don't necessarily come through our system. So what's really important for us to know and for the community to know are the positive tests. Those are the people that we need to work with, isolate, protect our community, educate those around them, protect them as well as we can, and monitor them as indicated. And so that's the information we need. The system works really well. There's a big list of reportable diseases, and COVID-19 is one of them. We will receive those test results from the laboratory. The doctor doesn't even have to remember to let us know. The lab automatically reports to the state of Tennessee. The state of Tennessee then divvies it out to each of the counties where that person lives. And so that's how we find out lots of other reportable diseases, and it works really well.
Can you go over one more time for one more question, guys?
Thanks.
Can you go over again the guidelines that you're following for the patients you're testing, the symptoms, and other outlying factors?
Sure. So if we are sending a specimen to the State Department of Health lab, the person has to have symptoms, a fever, cough. We're testing preferentially healthcare workers because of their risk with the people they take care of, pregnant women, women who have traveled or cared for someone with confirmed coronavirus. And sorry.
Anyone who's traveling.
Oh, I said, sorry about that. Anyone who's traveled, not just women, anyone who's traveled to a place where there's ongoing community transmission and symptomatic will get tested through the Department of Health. The Department of Health sets those guidelines to help target the most at-risk folks for testing, the folks that are most at risk for disease. And then we rely on our medical community to do some of the other testing, and they're stepping up in a big way in doing that. So thank you.
Thank you, guys.
Thank you.